This is Chapter 2, Critical Thinking and the Nursing Process. Every nurse, no matter what degree we hold, we all use critical thinking. It's like playing chess. You're trying to think one move ahead, 2 moves ahead, so you can beat your opponent. Okay? And we use the nursing process. So nursing process is the acronym ADPI. So it's assessment, diagnosis, planning, intervention, and evaluation. When you go through these objectives and you read them for each of the textbooks, this is information that you will need to know for exams. This is information that you need to know for your NCLEX. When you are performing clinical practice, these are the objectives that you should be using when you're at the clinical site or when you're in simulation. So as a nurse, critical thinking is the way we solve problems. It's extremely directed, it's got a purpose, and it's when we as nurses evaluate ideas, we make plans of care, and we determine what goals we want our patients to achieve. Reasoning is a synonym, used for critical thinking. Critical thinking for us as nurses, it does incorporate the scientific method, so we're always testing hypotheses, and we use clinical reasoning to make reliable and sound observations so we can draw conclusions from the information, the patient data that we have obtained. For you as a nurse, it is vital that you develop critical thinking skills. It is something that we continually build on throughout our nursing practice. And it does improve as we get further in our practice. Our thinking, we are able to put pieces together and make good clinical judgments. So when you're wondering, what does a critical thinker look like? What does a critical thinker do? Well, critically thinking means that you have this extremely open mind. You wonder why things are the way they are. You're able to understand yourself, the biases that you hold, your own limitations. We always are seeking solutions to problems. We're able to understand what information we've gathered is extremely relevant and we need to know. And what information is, yes, I need to know it, but it's not vital to this situation at the given moment. So we are always validating, looking for inconsistencies in data, because we can't make a diagnosis if our data is not consistent. We're able, when we validate, to identify anything that's missing. We consider every possibility. We use empathy. We're very organized. We will admit what we don't know. And we think logically. So there's a step-by-step process. When you sit for a moment and you were listening to this lecture, you were thinking. And you need to actually think about your thinking and how others think and apply your knowledge that you have learned and you know to your patient care. Critical thinking for us as nurses, it's based on science, scientific principles. It includes certain aspects like we gather data in an organized fashion. So we're going from head to toe. Okay, we do our head to toe assessment. That's why it's termed that way. We verify. We want to make sure that what we have is accurate. If something's missing, we need to recognize that. And then we are able to put the pieces together, cluster the information to determine how we can best help our patient. So, a critical thinker is said to be humble. They recognize their limitations, what they don't know. They know if their perceptions are being clouded by personal values and personal beliefs. They're able to communicate appropriately. They think before they speak. They deliver information clearly and concisely. Their documentation tells the story of them being with that patient and what they did with that patient for 12 hours. So when you consider the nursing process and going through each step of ADPI, you should understand why critical thinking, clinical reasoning, and clinical judgment are vital to the nursing process. And it's very understandable. It's because we're working with human clients. We're not working on machines. So we honestly can't afford to make mistakes. So the nursing process is a way of critical thinking, clinical reasoning, clinical judgment, and it is the language that we use within the nursing profession. As I've stated, it's extremely orderly. It helps you respond to the patient's current status at that given moment because you're able to plan and implement and evaluate all within 2 minutes to save that patient's life. It's also a way to communicate to everyone what is to be done and who's going to do it during each and every shift. It also assists us as nurses to provide a way to make changes in the patient's care if we're not meeting the evaluation criteria. So your nursing process, it builds on your patient's strengths and it helps create an actual partnership between the nurse and the patient, allowing for the nurse-patient relationship. These are ways, 4 actual ways that a practical nurse helps with the nursing process. So as far as data collection, which would be your assessment, a practical nurse helps the registered nurse by systematically review information about the patient and communicate it appropriately to other members within the team. When it comes to planning, the practical nurse will assist the registered nurse in developing outcomes as well as interventions for the care plan. With implementation, the nursing process provides the exact care from the nursing staff to accomplish the actual goals that we set with the patient. And when we evaluate, what we're doing is we're comparing what we expected, what our actual goals were, and we look at where the patient is currently. This allows us to update the nursing care plan because if we've met the goals, then we no longer need to work on that issue. So there's a lot of data that we actually have to gather. We make sure that we do a health history, okay, because I care about your first generation. So I want to know about their parents, illnesses, disease processes that they had. I want to know about their grandparents, and I want to know about siblings in the family. Okay, that all goes on the health history. I want to do my head to toe assessment. I'm also concerned about their psychosocial. So psychosocial is their living environment. What do they do socially? Do they maybe drink? Do they smoke? Okay, things they do in their social, their actual environment, their lifestyle. And then I'm concerned about their culture. Okay, so I need to know if I'm able to communicate well with my patient. Am I getting through to my patient? I'm concerned about their spiritual needs. Okay, because if it's a specific time of year, depending on the religion, it could be a very holy day to some individuals. So I want to make sure that I cover all of that. Then I also ask my patient questions. Okay, any information that comes directly from the patient. So the patient tells you something, that is subjective data. It comes from the subject. Okay, then we have all that other stuff, all that other information that we as nurses gathered. Blood pressure, height and weight. We look at lab results, test results, any odors that we might notice. Okay, if their skin's warm and dry, any sounds that we hear. So all of the other information, anything that does not come directly from the patient, is considered objective data. So we just talked about some information from the database when we talked about our health history and our patient's assessment. Okay, well, we also have focused assessments. So let's say your patient comes in and their big toe hurts. Okay, and you're thinking, well, routinely that's probably joint pain and that's probably gout. Right? So a focused assessment is only on one specific area. So why is the patient here today? What's their primary need? That would be a focused assessment. Obviously, interview is you asking questions. Socially, you're concerned about where they live, habits they have, the lifestyle they lead. We've talked about physical, we've talked about focused assessment. Okay, beginning of shift. So the report that I get from the nurse that's leaving before me, that's vital because it's all of my patient information. And I hope to goodness the nurse before me gives me a complete shift assessment. Don't just tell me vital signs. I need to know what happened during your 12 hours. It's important that I need to know to take care of this patient for the next 12 hours. What types of tests do we still need to gather? Is there any doctor's orders that we need caught up for this patient? All of that is vital for the shift report or the SBAR coming from the shift before the nurse. Okay, so here's your first question, and what I'm going to do is read the question, and then I'm going to wait 2 seconds and I'm going to read the answer. So when I'm finished reading the question, if you want to actually take time to answer this question, you'll need to pause your player. So the nurse notes that the patient is on long-term anticoagulant therapy. What patient statement would strongly correlate with excessive anticoagulant therapy? So to begin with, we need to understand anticoagulants. An anticoagulant ensures that the blood doesn't clot. Okay, this is select all that apply. I have noticed some blood streaking in my bowel movements. I have been embarrassed by constant uncontrollable gassiness. My urine has been cloudy with occasional clots. I bruise easily whenever I bump into anything. And flossing my teeth has been painful and bloody. The correct answer is number 1, 3, 4, and 5. So as a nurse, these are common diagnostic tests that we will see with our patients. It is important that we review all of this test information so we can determine what our concerns will be for our patient and to help us validate our assessment findings. Think about test data that's related to the patient's problems that would indicate an improvement or maybe a complication. So when it comes to the nursing diagnosis, the practical nurse reports information data findings to the registered nurse and assists in verifying, categorizing, and grouping all the information related to the patient. The nurse also will assist in analyzing data to help determine anything that's significant in the information, looking for problems or patient needs. We then develop a prioritized list of patient problems, and we focus on actual problems and potential problems that we can work on independently. Okay, so we actually use independent nursing interventions, and we don't have to have a doctor's order to do nursing interventions. From the analysis of data, your registered nurse will then, she will choose or he will choose nursing diagnoses from NANDA-1. So it's the North American Diagnoses Association International. It's a list of nursing diagnoses. So all of these nursing diagnoses are just generalized, and when we use them, we need to make sure that we put the problem, then we want to make sure that we state the cause of the problem, and that's our etiology. And then we want to verify that with evidence. So what signs and symptoms, what subjective and objective data do you know related to the problem? So as nurses, you need to realize that a nursing diagnosis and a medical diagnosis are not the same thing. Okay, the physician is concerned with the problem. Okay, what health problem is the patient here for? We'll go back to the patient with the toe. All right, so the doctor is now focused on the toe and the toe pain. Okay, whatever the doctor prescribes is what we will do to help the patient. A nursing diagnosis, we look at our patient and we look at their responses to their illness or a health condition, or it could be something like getting a prescription. It could be obtaining WIC for women, infant, and children. It could be multiple things that might be community related. So the top triangle is Maslow's hierarchy of needs. And if you look at or even remember from a prior course, the physiologic are basic life-sustaining needs. Well, the next colored blocks underneath, this is nursing using the hierarchy of needs, and it has been adapted to help determine the priorities of patient care. So stuff in the bottom, those are your physiologic, those are basic life-sustaining things that needs to be accomplished before anything else with that patient. What is considered critical in assessing sleep disturbance of the patient? Number 1, family history of sleep disorders. 2, the rituals associated with sleep. 3, feelings of restfulness. 4, diet choices. Or 5, urinary habits. Remember, this is a select all that apply. The answer is 2, 3, 4, and 5. So setting priorities of care. When we're determining what our priorities of care are as nurses, we use ABC first, which is airway, breathing, circulation. We then go into safety, and we use Maslow's hierarchy. So we need to make sure that we have met the physiologic needs first. Once you receive an assignment on your unit, you need to make sure you look at your patient's chart so that you get all of the information that you have. And if you do not understand or know what the action is of the medications that you're going to give your patient, you need to make sure that you look up the drug information, especially in case there would be any reactions to that medication. So nursing interventions, these are specific nursing actions and activities for our patients that will help our patients reach their goal and the expected outcomes. We use evidence-based practice to determine the interventions that we're going to use to help the patient reach their goals. When we are working on our nursing care plans, we want to make sure that we are using nursing interventions. Nursing interventions are independent, meaning that we do not need a physician's prescription to achieve these. If we need a prescription to achieve it, it is not a nursing intervention, it is a collaborative intervention. So for us as nurses, once we have looked up all of our information about our patients, we need to determine what patient we're going to visit with first. For us, prioritizing care is the most important step to plan competent and timely patient care. You want to make sure that you're using the ABCs, airway, breathing, circulation. You're considering patient safety, and then you're going into Maslow's hierarchy, which is the physiologic or basic needs to sustain human life. Interstaff communication occurs multiple times throughout the day. Sometimes our communication must be immediate so we can communicate urgent information that we've discovered during the assessment of our patient. Routinely, anything that is urgent, we're going to communicate verbally because it's going to require action now. For charting, as nurses, we'll chart on nursing notes, treatment flow sheets, medication administration records, and activity flow sheets. A lot of institutions, hospitals, yes. Extended care, some yes, some no. They have already instituted the electronic health record, which is computerized, and it's a comprehensive record of the patient's history and care throughout all of the facilities that they have visited and their admissions. A report, this is conducted at the changes of shift according to the facility policy and protocol. This will ensure that there is continuity of care for our patients. When you as the nurse are giving a report, you want to make sure that you use a good handoff so that way you're telling the next oncoming nurse anything that needs to still be accomplished. You're pointing out important allergies, any appointments that the patient may have that they need to attend to, any physician's orders that have not been changed and put into the medical health record. So for HIPAA, any information that we have related to our patient is only shared with someone that is directly related with that patient's care unless the patient has given prior authorization. As a student, any information that you have gathered for your education It cannot have any of the patient's identifying information on it. If you have something that has any protected health information, so a name, address, a medical record number, a room number, that has to be destroyed so we can adequately protect our patient's information. Interdisciplinary or collaborative care plans require that all the health team members that are involved in the patient care have some input. So our collaborative care plan is developed using the focus of each profession. Think about a nurse, a social worker, a physical therapist, or an occupational therapist. There will be a single care plan, otherwise it is considered as repetitious for each separate entity to have their own care plan. The focus of using a collaborative care plan is that we are all collaborating on the patient problem rather than just on the nursing diagnosis. Interdisciplinary care plans have the following characteristics. We use the medical diagnosis, not the nursing diagnosis. We want to make sure that we share all of the data that we have collected. A problem list is then developed and prioritized. The statement, the patient's admission problem is considered. Priority is always given to life-sustaining or physiologic needs, so thinking ABC or Maslow's hierarchy. A shared care plan for across all of disciplines will be created. The plan will be discussed with the patient or the advocate because the patient needs to be on board whenever we are following the care plan. And we want to make sure that we document all of the progress for our patient. Evaluation is always ongoing. We want to make sure that if the patient has met the goal or interventions have been accomplished, that they are either deleted, sometimes we need to add them, or potentially we need to change them depending on the patient's needs and necessities.